Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory, and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have a thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Snehal Kalanrti, is a well-known dermatology and has been practicing medicine for over many years now. She's MBBS MD dermatology. She specializes in dermatology, cosmetology, and trichology. She owns a clinic and currently practicing as a consultant dermatologist at Skin Care Solutions, Skin Laser Cosmetology, and Hair Clinic Nashik. Dr. Snehal has dedicated her career to diagnosing and treating a wide range of hair and skin conditions while providing personalized healthcare services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Snehal is aware of the need for the patient education and an awareness about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Snehal, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you, Mona, for your kind introduction.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया टुडे वी आर गोइंग टू टॉक अबाउट हेयर केयर इन करंट सिनेरियो एंड जब भी हम हेयर केयर इन करंट सिनेरियो पे बात करते हैं तो हेयर लॉस इज द मोस्ट कॉमन प्रॉब्लम irrespective of gender or age. So can you please enlighten us today, like what's normal and when to be concerned for?
Okay, so normally shedding of there is a difference between hair shedding and hair loss. Okay, so if you have a hair fall or hair shedding of 50 to 100 hairs per day, that is
Mhm.
absolutely normal. You should be concerned when there is hair fall more than that, or if there is thinning of the scalp or receding hairline, or if you see any bald patches on your face, on your hair scalp. Sorry.
Okay, doctor. So, doctor, like, what are the general causes? ये hair fall है और या hair loss क्यों होता है और क्या causes हैं और क्या factors हैं इनके पीछे?
So, सबसे पहले the most common cause is genetics. So we know in males it's androgenetic and in females in female pattern hair loss. So it's genetic. It's most of the times hereditary. And sometimes patient also say कि नहीं मम्मी पापा के बाल अच्छे हैं घर में सबके बाल अच्छे हैं, but still how can you say it's a genetic hair loss? So genes can be mutated after the birth also, so need not be hereditary. And that is the pattern hair loss. Second most common cause what we see is nutritional. So nutritional maybe iron deficiency, B12, calcium, vitamin D, and some micronutrients deficiency, even protein deficiency can cause. Other most common cause what we see is stress. Now even a 5-year-old kid has stress, and people do have like everyone has some or the other stress in life.
Mhm.
Stress being can be a mental stress or also physical stress. Physical stress in the sense like if you have been operated for something, or if it's a post-delivery situation, or if you've been admitted for dengue, malaria, or even COVID, or some other illness. Or you've been traveling a lot, or you've been like the workload has increased. So this is kind of physical stress, and usually you see hair loss after 3 months of the stress, and that
Mhm.
we usually call telogen effluent.
Mhm.
Also, we have other reasons like autoimmunity, especially alopecia areata. And
Mhm.
autoimmunity is basically your body cells consider your hair cells to be foreign.
Mhm.
And just like something we call, just like SLE or rheumatoid arthritis, these are also autoimmune condition.
Mhm.
Hormonal changes are known to cause hair fall,
Mhm.
specifically in females who have polycystic ovarian syndrome. Thyroid disorders are known to cause hair fall.
Mhm.
Uh, and again, some chemotherapeutic agents and some drugs can cause hair fall.
doctor. So, doctor, there are so many reasons which can cause hair fall or hair loss, and you also mentioned about stress. And nowadays, like we all are having a bad lifestyle, poor lifestyle, like working late night and eating junk food, not cooking, or not eating at right time. So, can a person's lifestyle play a role in hair loss?
Yeah, definitely a lifestyle plays important role. First thing, lifestyle, your food, what you eat. Junk, definitely, if there is a lot of junk and less of healthy food, so
Mm-hmm.
your protein is something which is very important. So you should eat high protein diet.
Mm-hmm.
And again, if there is again in protein, some people
Mm-hmm.
have started using whey protein supplements. So that's an important point. Don't take whey protein for your hair loss. Whey
Mm-hmm.
proteins are known to increase DHT levels and increase hair loss. So if you want
Mm-hmm.
to eat protein for hair loss specifically, so avoid milk-based proteins or whey protein. Try
Mm-hmm.
plant-based, or then otherwise, if you're a non-vegetarian, you can try eggs or chicken or other non-vegetarian source of protein.
Mm-hmm.
Uh, Again, sleep pattern. If your sleep pattern is not normal, again, it's stress. It will increase cortisol levels and definitely have you'll have hair fall. Addictions in your lifestyle, even smoking is a major cause for hair loss.
Mm-hmm.
Exercise reduces stress levels and uh, it helps to keep your hormonal balance, and that's
Mm-hmm.
the way it will reduce your hair fall. Again, weight loss or diet, what we say. If there is weight loss or you're planning a proper diet, don't go on crash diet. Crash diet again is a stressful condition for your body. So if you're
Body.
on crash diet, or if you're losing almost like 8 to 10 kgs a month, that is definitely going to cause hair loss. Try to lose steady weight like 3 to 4 kgs a month. That should be your target, not more than that.
Mhm. Okay, quite interesting, doctor. Like losing a weight too early with the like unhealthy weight loss is also not good for
Yeah.
our health. Okay, so doctor, now that we have talked about hair loss and the causes of hair loss, another question जो हम सब common people के दिमाग में रहता है कि what are the medical treatment options available for hair loss? Like there are surgical or non-surgical, या फिर topical भी है या कोई oral भी है जो हम लेके अपने hair loss को manage कर सकते हैं.
तो हेयर लॉस के लिए बहुत सारे ट्रीटमेंट अवेलेबल है. फर्स्ट थिंग
हम्म.
इज डोंट ट्राई ट्रीटमेंट्स ऑन योर ओन.
हम्म.
कहीं पे भी आपने सोशल मीडिया पे देख लिया कि बायोटिन खाना है, आपने बायोटिन खा लिया, मिनॉक्सिडिल लगाना है, मिनॉक्सिडिल लगा लिया. और नाउ
हम्म.
पीपल हैव टेकिंग मेनी थिंग्स लाइक फॉर हेयर लॉस. फर्स्ट थिंग इज
हम्म.
कंसल्ट स्पेशलिस्ट.
हम्म.
एंड देन पहली चीज है कि नो व्हाई आर यू गेटिंग हेयर लॉस. सो जेनेटिक्स, ओके. Other
हम्म.
thing is check your nutrients level. Checking
हम्म.
basically iron, your hemoglobin, B12, vitamin D, even thyroid function test.
हम्म.
If anything is abnormal, we'll supplement those things.
हम्म.
And if everything is normal, then we can start. There are topical therapies available. We can take topical minoxidil, finasteride. There are topical peptides available. Um, Also, oral, now we have oral minoxidil, oral finasteride, dutasteride. So many things are available. Surgical, obviously, for the cases where there is no scope, where we cannot regrow the hair, we can definitely go for hair transplant surgeries. And lastly, if there is no option left, there is camouflage. Camouflage is always an option. Wigs are always an option. But
हम्म.
if you start your treatment early,
हम्म.
you will not need the surgical option or camouflaging options.
Okay, so early intervention is the key also in
Yeah,
case.
that's very important.
Okay, so doctor, nowadays you mentioned about diet and the nutrition, and nowadays a word called nutraceutical is getting a lot of focus. So can you enlighten us today with your profound experience? Like, what is the role of nutraceutical in hair health, and what is it exactly?
So nutraceuticals is like now being a term which is being used commonly. It's a very confusing term. Nutraceutical is basically a substance which we derive from plants or animal sources. which
Mhm.
add as an what you say supplement. But
Mhm.
problem with nutraceuticals is there is no they have been regulated with by FDA, but the
Mhm.
norms are not as strict as pharmaceuticals. Like
Mhm.
if you have iron tablet which has elemental iron of 60 mg, and what is the base, whether it is sulfate, and what are the contents, it's a pharmaceutical compound. So you have strict guidelines कि इसका सब ऐसे चाहिए. It goes through so much of checking. But nutraceuticals nowadays, you just get biotin gummies or something which you don't know
Mhm.
कि उसका carrier क्या है या उसमें क्या क्या content है. Exactly, it is not mentioned. So
Okay.
I would always recommend go for supplements which you know कि which has how much content of what. Try always taking from a pharmaceutical company. And
Mhm.
yes, there is role of nutraceuticals.
Mhm.
Um, Micronutrients like zinc is important, selenium is important, iron, B12, vitamin D, everything is
Mhm.
important. Even some nutraceuticals which have saw palmetto, or
Mhm.
what you say, it has saw palmetto and all. These things,
Yes.
yeah. So even these things have shown proven benefits, like curcumin is there.
Mhm.
These have shown benefits, but these cannot be the sole treatment. Like it cannot
Mhm.
be like you're taking only nutraceuticals and your hair are going to grow.
Good.
This can be an additional thing.
Mhm.
You have to take proper treatment, and in addition, you can take nutraceuticals.
Okay, quite interesting, doctor. So, doctor, you mentioned about this micronutrient. तो प्लीज आप बता सकते हैं माइक्रोन्यूट्रिएंट्स क्या होता है, क्योंकि हमने सुना है मैक्रोन्यूट्रिएंट भी होता है, माइक्रोन्यूट्रिएंट भी होता है. So, can you tell us the like what's
तो
the
मैक्रो इज बेसिकली सिंपल लैंग्वेज में जो ज्यादा क्वांटिटी में बॉडी का रिक्वायरमेंट रहता है. तो दैट इज बेसिकली योर कार्बोहाइड्रेट, प्रोटीन्स एंड फैट्स,
Mhm.
एंड ऑल योर विटामिन्स एंड मिनरल्स.
Mhm.
जैसे विटामिन A B D E K जो है वो,
Mhm.
एंड योर मिनरल्स स्पेसिफिकली आयरन, जिंक, कॉपर, कैल्शियम, सेलेनियम. ऑल
Mhm.
दिस आर माइक्रोन्यूट्रिएंट्स. सो
Mhm.
हेयर के लिए स्पेसिफिकली माइक्रोन्यूट्रिएंट्स में सबसे पहले आयरन. We can
Mhm.
go like minerals में iron, calcium, to some extent, yes, selenium, zinc, copper, all these are important.
Mhm.
And for what we say vitamins में B12, D3.
Mhm.
Yes, biotin is important, but it's not. It's more of a marketing thing कि आप biotin खा रहे हो बाल बढ़ जाएंगे, ऐसे नहीं है. Biotin is important in people who have actual biotin deficiency. आप
Mhm.
साल भर से biotin supplements ले रहे हो, it's not going to help. We
Mhm.
do give biotin along with other micro in combination with other
Mhm.
micronutrients. But
Mhm.
first, you should know ki, what other nutrients are deficient, and you have to supplement with that. Also,
Mhm.
randomly biotin interferes with your test reports of thyroid and even
Mhm.
tropy, what we say.
Mhm. Okay, quite interesting, doctor. So, doctor, now that we know about hair loss and its treatment and other causes, how does hair loss happen? So, another very common problem is the dandruff. So, can dandruff cause hair fall?
Dandruff as such will not cause hair fall, but
Mm-hmm.
dandruff will cause itchy scalp. And
Mm-hmm.
itching is the main cause, like it's causing your hair fall. Again, if dandruff left untreated, it will cause inflammation, redness in your skin,
Mm-hmm.
and then again it will cause hair fall. So
Mm-hmm.
best to treat your dandruff to prevent hair fall.
Okay. So, it is important to treat the dandruff also so that it doesn't lead to itchy
Yeah, it
scalp.
doesn't directly, yeah, it doesn't directly affect, but if you treat it, it won't lead to itchy and redness and everything, and which is secondarily causing your hair fall.
Okay, okay. So, doctor, earlier you mentioned about stress. So, can you please little elaborate us like the how does this stress impact our hair health and how can we manage it? Because nowadays we all are having stress. We can't avoid it. Yeah.
Okay, so basically, stress increases your cortisol level, and it causes telogen effluent. What we say, telogen is the after stress, like usually, see, like even when we see kids, of 10th or 12th grade, and they come like we were not having any hair. If we say कि एग्जाम स्ट्रेस की वजह से आपको हेयर फॉल हो रहा है, तो बोलती मैं एग्जाम टाइम में कुछ नहीं हो रहा था, अभी ये वेकेशन टाइम पे हो रहा है, बिकॉज स्ट्रेस के 3 महीने बाद एक्चुअली हेयर फॉल स्टार्ट होता है. So, and even everyone has their stress, and there cannot be one solution for stress. But something which is important is start something recreational. Either do some yoga, meditation, exercise, play badminton, or any game what for any sports you like. Or if you like dancing, if you take that half an hour for the things you like, that might reduce the stress. We cannot take away the reason for the stress, but at least these things will reduce the stress, and in turn it will reduce hair fall. And first thing, most important thing is don't take stress of hair fall. People are losing hair because वो चार बाल पे इधर उधर गिर रहे हैं, तो they are taking stress कि I'm getting hair fall, I'm getting hair fall, and in turn increasing hair fall. Have patience, your therapy is going to work, and first month में it's not going to work. It will take at least 3 months to see at least some response. पहले महीने में कोई रिस्पॉन्स नहीं दिखेगा, सो डोंट टेक स्ट्रेस ऑफ हेयर फॉल की मैंने ट्रीटमेंट चालू किया है फिर भी नहीं इम्प्रूव हो रहा है. एटलीस्ट वेट फॉर 3 months and slowly it will improve.
And also those people who are losing lot of hair or don't have hair due to lack of confidence, they feel stressed. So it's better they visit the doctor.
Yes.
Yeah. So doctor, like जब हम लोग stress में होते हैं, and even we most of us are like working from home nowadays, and एक चीज है जो हमारी मम्मियाँ हमें बोलती रहती है, मसाज कर लो ऑयल का, स्ट्रेस रिलीज हो जाएगा, भर भर के ऑयल लगाओ, बाल घने सुंदर थिक और लंबे होंगे. So what do you think, oiling is a boon or a ban? What's the fact behind this?
Okay, we cannot say boon or bane. The thing is, oil will not increase hair growth, but you can use it for conditioning. Okay, if you use oil for your hair like half an hour or 1 hour before, for not for your scalp, for hair. So people who have wavy hair, dry hair, frizzy hair, specifically coconut oil, it can penetrate your shaft and repair it. It helps for smooth, what you say, giving that smooth look or reducing the frizz. In that way, if frizz is reduced, tangling will be less, and your hair fall will be, because hair breakage is reduced. Other thing is massage. Yes, it's okay if it is relaxing. If it's relaxing and a gentle massage, just for relaxation, reducing stress, half an hour before you take an head wash, that's fine. But overnight oil application is not recommended. Specifically, it increases dandruff. Basically, dandruff. Whenever I say कि oil से dandruff बढ़ता है, patients like ये ऐसे कैसे? So basically, dandruff is an yeast which grows on the free fatty acids from the oil, and it will increase. So again, some oils like rosemary oil or maybe castor oil, even in some studies, onion oil have seen to promote hair growth. There are studies, and yes, these things can promote hair growth, but these things cannot be a solo thing. You can add as an adjuvant. And again, if you're using some medical treatment, or for say, if you're using minoxidil or some peptides, oiling your scalp will reduce the penetration. Since these are alcohol based, it might hamper with the penetration of your drug which you're using. So, as such, oiling will not increase the hair growth, but you can do once in a while or just before your hair wash for conditioning of your hair.
Okay, quite interesting, doctor. So now my favorite part, doctor, can you please give us some important tips for healthy hair?
Important tips for healthy hair. So, first thing is have a proper diet and lifestyle. That is very important. Get yourself, if you're having excess of hair fall, get yourself checked for common things like iron, B12, vitamin D, thyroid disorders, and whatever is deficient, please do correct it. And do start your treatment as early as possible, even if in your 20s or 30s. Start it early so that you don't get fibrosis, or in late stages, medicine is not going to work. So you have to start it early. And also, something about minoxidil, I want to say people have a fear that minoxidil एक बार चालू किया तो लाइफ लॉन्ग लगाना पड़ेगा, नहीं अगर हम छोड़ दें, मिनॉक्सिडिल बंद करने से हेयर फॉल होता है. सो बेसिकली मिनॉक्सिडिल बंद करने के वजह से हेयर फॉल नहीं हो रहा है. हेयर फॉल आपको ऐसे भी हो रहा था बिकॉज इट इज जेनेटिक. वी कैन नॉट चेंज योर जीन्स. एंड minoxidil was something which was preventing hair fall, and promoting hair growth. So you will have to use it continuously until you need your hair. It is something like a fertilizer. Like आप fertilizer डाल रहे हो तो plant grow हो रहा है, वो बंद करोगे तो obviously hair fall होगा. इसका मतलब ये नहीं कि आप fertilizer water सब डालना बंद कर दोगे plant को. So don't have that fear, and do take treatment.
Yeah, and like you said before, early intervention is the key. So, Doctor, this
Yes.
discussion was very informative. I'm sure our viewers have found the session very helpful. So, can we take some live audience questions, Doctor, please?
Yeah, sure.
Hello, ma'am. I have seborrheic dermatitis for 3 to 4 years, but now it is under control. But from last year, I have severe hair fall. Can my hair regrow?
Yes, hair can regrow. That depends on what is the cause. So, seborrheic dermatitis, if you lost hair, definitely it will regrow. We'll have to check by using a dermoscopy that how much percentage of hair can be grown. Is there any fibrosis or something? But definitely, we can regrow the hair.
Okay, okay. Hello, doctor. I'm 35 years old and I'm having androgenic alopecia. I'm also from Nashik. Can you please tell me where is your clinic? I want to come for an appointment. And also, I've met 2, 3 doctors. They gave me a lot of vitamins and mineral. Do I need to take them for whole life?
Uh, okay. Address, definitely it's on Sharanpur Road. It's as a skincare solution just opposite to the police petrol pump.
Mm.
I mean, if Mona, you can put it on the
Yeah,
chat.
yeah.
And also, minerals and vitamins, you don't have to take lifelong. It's not needed at all.
Mm-hmm.
You just have to correct the deficiency which you have. Like depending on what deficiency you have, you can take for 3 months, 6 months, and
Mm-hmm.
maybe after that we can stop. And biotin also you can just take for 1 or 2 months, not more than that is.
Okay, so it's not like lifetime people do need to take the medication. It is like according
No,
to the
not at
doctor.
all.
Okay, okay. Okay, so he can visit you. Another question from our viewer is, hello doctor, I am at a menopausal age and I have a lot of hair fall. My neighbor told me I should go for PRP or a hormonal therapy. So do you suggest that they will help me to regrow my hair?
Yes, PRP can help, hormonal therapy can help, but we need to first check, because according to age, there might be some fibrosis or loss of follicles.
Mm-hmm.
So we need to check how much percentage of hair can we regrow. Yes, but definitely there will be some response and further progression will also be reduced.
Okay.
But directly jumping for a procedure, it is always better. We first go with topicals and then topical or oral medicines and then go for PRP.
हाँ एक्चुअली लाइक आजकल तो सलून में भी पीआरपी लोग करते हैं सो इट्स बेटर टू गो टू द डॉक्टर एंड
No, no, saloon mein PRP is not a good idea. You might have read the US news also that people have got HIV and all because
yes.
the sterilization method is not good. We should always do it at a doctor's place only. It involves blood and injections, so it should be done at a dermatologist place only.
Okay, okay, doctor. Oh, there is one interesting question, even I want to know. Doctor, how to get a clear skin like you? Can you tell us your skin regimen?
Okay. Okay. My regimen, frankly speaking, I don't do much, but few basic things what I follow is moisture, a good cleanser. It's a dry skin, so I use a gentle cleanser. But people who have oily skin can go for salicylic acid or glycolic acid based cleansers.
Mm-hmm.
Uh, Moisturize immediately after washing your face,
Mm-hmm.
and a sunscreen is must every 2 to 3. I mean, not 2 to 3 hours. Practically, it's not possible. At least 3 to 4 hours.
Mm-hmm.
And depending on your skin, like maybe retinol, maybe adapalene, maybe whatever skin issue you have, you can start.
Yeah, in fact, also like people do follow the social media. Instead of that, we can also go for our
No,
skin.
no, please don't do that. Just get your skin checked and what active will exactly suit you, and then you can start.
I think she can visit you. Yeah. Another question, doctor. I think so. It is for some excessive hair for this patient. He is asking that I have unwanted hair. Is there any medicine or cream for that? Some people may
Uh,
have some excessive hair grow on their
Yes,
face.
we do have medicine creams for unwanted hair.
Mm.
First of the thing we should see, it's a male or female. Like
And
in females,
nothing.
there might be hormonal changes or something. Like
Mhm.
specifically PCOS may cause. So you need to correct that, and that will improve your hair. Excessive hair will be lost. And again, we can give creams. There are fluorochrome creams available. We can give. Also,
Mhm.
laser hair reduction is best thing for that if you want.
Okay, okay. Yeah, laser can also help. Yes, it is getting lot of like getting famous nowadays, laser treatment. I'll
It's a good
quickly take the last
procedure.
question from our audience because we are running out of time. Doctor, my daughter is 12 years old and she has a lot of white hairs. So, is there any solution to stop it and can I come to visit you?
Yeah, definitely you can visit. 12 years old. Yeah, nowadays we are seeing like even 8-year-old, 9-year-old getting brain premature candidiasis, what we call.
Mhm.
So, if we get a cause, like exact cause for it, like if there is B12 deficiency, iron deficiency, or if there is maybe protein deficiency, we know the cause for whitening. We can check the levels. If we
Mhm.
know the cause, definitely reversal of gray hair is possible.
Mhm.
Second thing we can do, try micronutrients and calcium supplements for 3 to 6 months to see whether gray hair can be reversed. But
Mhm.
in spite of all this,
Mhm.
only 20 to 30% people will get a reversal, like get their black hair back.
Mhm.
So otherwise, it's mostly genetics and
Mhm.
maybe the change in environment, change in the food we eat, the pollution and everything that is causing graying. We are seeing early graying, but definitely we can try.
Okay, okay. So it can be stopped, but cannot be reversed.
Uh, in very few people. If we know
Okay.
the cause, definitely it's going to help. Definitely there can be reversal. But if in spite of correcting all the deficiencies and still if there is graying, then
Mhm.
nothing can be done. You just have to color.
So instead of worrying at home, they can visit and have a look like what's the root cause.
Yes, at least we can do their blood checkup and see.
Yeah. So, doctor, would you like to give a take-home message or any other suggestion to our viewers today?
No, nothing specific. Just in hair care, just don't follow trends and see the science behind the thing and start your treatment early.
Okay, start your treatment early, even take your hairs seriously apart from other health concerns. Thank you so much, doctor. Thank you so much for sharing so much of information and all your expertise with us today and answering all the questions of our viewers today. I'm sure our viewers have found the session very beneficial. Thank you, doctor. It was delight to have you, and thank you so much for your valuable time.
Thank you so much, Mona. Thank you for your time and it was nice talking to you.
Yeah, and even our viewers have participated very nicely. It's good. Thank you, ladies and gentlemen, for joining us today. We are
Yeah,
signing off
thank
for
you,
today.
everyone.
Yeah. Thank you. Have a nice evening, doctor. Bye bye.